The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. This video is going to show how to safely guard someone while they are ambulating. It shows one caregiver guarding on one side of the patient. In some cases, it may be appropriate to have two caregivers, one on each side of the patient, or have one person alongside the patient and another following closely behind with a wheelchair. If the patient typically uses an assisted device, such as a walker or a cane for ambulation, or if the physical therapist at your hospital has recommended that they use one while they are hospitalized, make sure that they use this device while you are walking with them. This will be much safer than any alternatives, such as holding onto your hand, an IV pole, a wall rail, or simply not holding onto anything. If the patient has not been using an assisted device, but you suspect that they may need one because of difficulty with balance, consider asking for a physical therapy consult to assess the need for an assisted device. When assisting a patient while they are ambulating, you should always have a gait belt on the patient. A gait belt serves as an important point of control. It is placed at the center of the patient's mass and therefore can be used to control how their mass is moving. It also prevents you from having to pull on a patient's upper extremities or clothing should they lose their balance. Position yourself behind and towards one side of the patient. If the patient is weaker on one side than the other, this is the side on which you should stand. Hold on to the gait belt with the hand closest to the patient with your palm facing up. Your opposite hand is best placed near the patient's shoulder or sternum. It doesn't have to be touching the patient, but in this position it is ready to contact the patient's trunk should she begin to fall, particularly in the forward direction. As the patient begins to walk, move along with her. Try to keep your feet in a wide stance most of the time, and don't cross your legs as you walk along with the patient. You want to make yourself as stable as possible as she walks, so that you are not off balance yourself should she begin to fall.